Welcome back to the High Tea Podcast. Today, we'll be continuing our conversation with former NFL chiropractor Tommy Rhee. Make sure to listen in to hear Tommy's takes on redefining pain and what it means to be an athlete who really understands their body. This is the High Tea Podcast.
So we're going to do the rapid fire questions again. Most misunderstood recovery tool.
Stem cell therapy.
How long should stretching be?
Depends. If you're doing a pre-workout, you want to listen to your body. Get the temperature up, get the joint feeling good, make it feel like you're ready to tackle 100% activity. The static afterwards, it's cool down. So it all depends.
One thing people panic about too quickly.
Injury.
Finally, one thing people ignore too long.
Therapy. When to start therapy.
Great. So one of your most interesting ideas is that pain isn't always something to eliminate, but it may actually be information. You talk about pain as a biological signal instead of just a symptom. What does that actually mean?
So the old way that we used to think about pain is just there's something going on and let's go ahead and mask the pain, reduce that sensation so we won't have that achy feeling. Well, the thought process now is that what is really going on with this information that we're getting from that particular body part? It's a signal. It's a damaged tissue. It's either in sleep mode or zombie mode, like a senescent. It's telling you, hey, we need to address this quickly or it's going to be worse as we go further into it. So that's how I look at pain. Pain is really the information of what is going on in the cellular level.
Yeah, so as you mentioned, we try to get rid of discomfort as quickly as possible. So why do you think we often silence the discomfort instead of embracing it and figuring out what's actually wrong?
Yeah, nobody likes pain. Nobody wants to address the real problem of why the pain is there. They just want to mask the pain. So you think about when you go to like a pain management place and then you've got some type of arthritic situation in your knee. Okay, well, let's numb the knee. Goes, oh, well, look, my knee feels better. I'm okay. Well, guess what? It's still deteriorating. It's still having its problem, except for now you just took out the sensory component, the information that's signaling you, hey, there's something going on. And then we have to send the right signals or information back to the cell to say, do your job.
Great. So how should people think differently about recovery? What should be their first steps?
So when you look at that situation, you're going to have to say, how do I recover from this? Well, guess what? Depending on your point of like your life, if you're a younger person, you have great signals. When you're older like me, you don't have that strong signal. So you're going to have to do a lot of informational, like almost like massaging the information to send the right signals to that ankle to do its job. You've got to send information to do the anti-inflammatory to slow the inflammation down. One of the big key things about an ankle when it swells, it's the pain because you're putting so much fluid into the joint that your joint has inability to do its motion. So when you have less movement and you're kind of pushing that fluid outward, you're hitting these sensory neurons out there is giving you more of a pain indicator. So you've got to get that fluid out. So again, it's about really controlling that whole mechanism that's going on with that ankle injury, with that recovery.
Okay, so for younger listeners involved in sports, what's the difference between pushing through discomfort and just straight up ignoring warning signs?
Yeah, that's a big one. It's easier for adults because we've been through the mistakes. We learn through our mistakes. That's the biggest lesson, right? Going through it. So with younger people, it's about listening to your coach, therapist like myself. You have to be really ready to receive. And that's tough. You know how kids are sometimes. I know more than my parents. Here's a good story. My son plays football, right? He played high caliber football and he got injured. Now, I'm in the field. I'm talking about from the Olympics to the NFL. He sees my caliber of therapy and my clients. So he sprained his ankle, but then he started questioning me about my therapy process. I looked at him and goes, okay. So that's that teenager, doubting what I can do, especially a father-son relationship at that time of his life. So that's a tough thing. You just got to be humble and just listen to someone that has the experience and just follow that pathway. Give all the information out to the doctor and then get ready to receive the therapy and instructions how to recover.
For teens who are maybe more low income or can't afford that kind of physical therapy, are there other at home alternatives that you would say work?
That's a great question. Look at the information out there on the internet. You can Google a lot of things. You can do a lot of AI stuff, chat, all those guys. If you're around a team environment and the coach should have some type of provider to help out, some trainer. So the problem with that is that when you work with a team, it's, you're so saturated with a lot of players versus one guy. It's tough. I see that part. So it's a luxury to have that professionalism and that kind of caliber where you're working one on one with an athlete and a provider. But if you're in that environment where you can't afford it, you start with that AI world. Just Google it, figure out that point, and then from there, go to your trainer or your coach and ask them, "Is this a good process? Is this something I can do for myself?" So it's a good starting point.
Kind of pivoting a little bit to your TEDx message. So your TEDx message centers around signals, not force. Can you explain that to the everyday person?
So if you look at medicine, you always hear about things forcing, right? We want to replace it. We want to do like an artificial knee when you have the arthritic knee. Our body has the ability to do things. Our cells are sitting dormant. It's about getting the right signal to your tissue. So when you're injured or your age, our signal decreases. Now, when you have a decreased signal, we have to figure out a way to get that signal brighter. So when you think about a signal, you think about what inhibits a signal. Well, inflammation, that's one of the inhibitors. Get the inflammation out, the signal can get to the target tissue to do its job.
Great. What does regenerative medicine try to do differently?
Well, regenerative medicine is like a general terminology, meaning that we're just trying to regenerate the tissue, right? We take every type of device to speed up that process. Then you start thinking about this world of stem cell therapy. So stem cell therapy are things that you take, like this thing called a mesenchymal stem cell. It's just a little stem cell that people get from either your own body, fat tissue, or the bone marrow. And you get these mesenchymal stem cells and you inject it into your own body where it has a damaged tissue, and it signals your existing tissue to do its job. So the evolution of this whole regenerative medicine stem cell therapy was like people thought that you wanted live cells into your body. Well, the problem with live cells, these cells, you don't want the nucleus because you don't know what they're going to replicate in your body because you don't want tumor formation. What you want is the signals. Every cell secrete, right? They secrete these things called EVs, extracellular vesicles. Well, that's what mesenchymal stem cells is. Now you have a non-nucleus, what they call a cell-free type of like information that has no nucleus. So when you get it in your body doesn't fight it like it thinks it's a virus. It just accepts it. And when it accepts it, it goes to that target tissue that's ready to receive it. And then once it gets that information, it does its job to regenerate through its anti-inflammatory or cell division mitosis.
That's super fascinating. Okay, so talking about regenerative medicine, how do you balance innovation with that healthy skepticism? Because obviously there are risks with any type of therapy and like stem cell therapy. So how do you balance both?
My big thing is that safety is a big factor. When I look at what patients are going through right now, so when we get invasive with a needle, surgery and all that, you're always thinking about the worst thing, which is infection. You don't want that bacteria or virus in your body. So that's the first thing you think about the current delivery system, which is the needles. So the advancement is that you have to have another delivery system that don't use the needle. Topical. A topical application where you're looking for those cell-free molecules to get through the skin transdermally and get to the target tissue like the muscle, bone, tendon, ligament to signal your existing tissue to do its job. And that's where the evolutions are going to move to. It's going to occur where now everybody can just basically use this cream, rub it on that particular body part, and then do the same thing as the injectable, but more importantly, signals your existing tissue to do its job.
Last question on this episode. What's one healthcare belief that you think might look outdated in 20 years?
Injections, needles. Everybody's afraid of needles. Everybody don't want needles. You're going to see that disappear as far as like delivering any type of like medication or stem cells or signals or any type of like healing process.
Tune in next week to hear Tommy's journey in the NFL, the highs, the lows, and the crazy stories that come with being a chiropractor for the highest level of professional footballers. This is the High Tea Podcast.